Hello everyone, welcome. Today our topic of discussion is diabetes mellitus. What is diabetes? Diabetes is group of metabolic disorders characterized by chronic hyperglycemia. Hyperglycemia means increased blood glucose level. Hyperglycemia is resulting from defect in insulin secretion, insulin action or both. Pancreas is main organ in glucose homeostasis. Small portion of pancreas is made up of islet of Langerhans containing alpha cells, beta cells and exocrine acinus. Beta cells secrete insulin. Insulin is only hormone that is capable of lowering blood glucose level. Any damage occur to B cell or insulin secretion is impaired or insensitivity to increased insulin occurs. All these mechanisms lead to chronic hyperglycemia. Mechanism of insulin release. Due to the electrical activity, depolarization of beta cell membrane occurs. This leads to voltage gated calcium channels to be opened. This leads to influx of calcium into the cells, leading to elevation of intracellular calcium. This elevation facilitates the insulin secretion. After eating a meal, carbohydrates are broken down into the glucose, and this glucose is passed down into the bloodstream. And pancreas detects this glucose level and secretes insulin. This insulin stimulates target organs like liver tissue, adipose tissue, muscle cells and other cells. Secreted insulin helps liver to increase glucogenesis, adipose tissue to increase lipogenesis, muscle cells to increase uptake of amino acids and other cells to increase uptake of glucose by increasing glucose transport proteins in the plasma membrane. Low insulin and or insulin resistance of target tissue means target tissue are no longer responding to normal insulin level. This is responsible for metabolic abnormalities. Mainly three types of diabetes are there: type 1, type 2 and gestational diabetes. Type 1 diabetes. It is occurs due to destruction of beta cells of pancreas. Mainly occurs in the children and adolescent. Etiology is autoimmune destruction of beta cells. These autoantibodies against islet cells is hallmark of type 1 diabetes. They are islet cell autoantibodies, insulin autoantibodies, glutamic acid decarboxylase autoantibodies, protein tyrosine phosphatase, zinc transporter 8 autoantibodies. Factor influencing type 1 diabetes are genetic factors, viral infection like rubella, enterovirus, rotavirus, herpes virus, cytomegalovirus, etc. and obesity. Type 2 diabetes. 95% of the patient of diabetes belongs to this category. Sedentary lifestyle, poor, less healthy food and obesity are the risk factor for type 2 diabetes. In type 2 diabetes, target cells and organs need more insulin as time passes. This is called insulin resistance. This increased demand could not be met by pancreatic beta cells due to defect in insulin secretion. This leads to gradual destruction of beta cells. This reduces insulin secretion over time. Insulin resistance lead to obesity, nephropathy, essential hypertension, dyslipidemia, ovarian hyperandrogenism, non-alcoholic fatty liver disease, and systemic inflammation. Diabetes also found in patients with other endocrine disease that secrete excess hormones like growth hormone, glucocorticoid, glucagon, and epinephrine. And these diseases are acromegaly, Cushing's syndrome, glucagonoma, pheochromocytoma, Down syndrome, Klinefelter syndrome, Turner syndrome. Who should be tested for diabetes? Whose age is more than 45 years, who is overweight, younger than 45, and have one or more additional risk factor such as high blood pressure, high cholesterol, family history of diabetes, and having a history of gestational diabetes, or delivering a baby more than 4 kg. Routine laboratory tests performed in diabetes mellitus are FBS, PPBS, GTT, and RBS. All are suggesting short-term glycemic control. HbA1c suggesting long-term glycemic control. Lipid profile, cholesterol, HDL, triglyceride, LDL, VLDL. Renal function test, creatinine, urea. Urine glucose analysis also suggest short-term glycemic control. Urine protein, urine microalbumin, urine albumin creatinine ratio suggest kidney function. Urine ketone analysis. It is elevated in cases of diabetes ketoacidosis. Insulin autoantibodies, GAD65, anti-IA2 antibodies, zinc transporter 8 protein. These all are important to diagnose type 1 diabetes. Let's learn the diagnostic criteria. Any symptom of diabetes such as increased thirst, increased appetite, increased fatigue, increased urination, weight loss, blurred vision, ulcers that are not healing, and or HbA1c measure more than equal to 6.5% or fasting blood glucose measures more than 126 mg per dl, or oral glucose tolerance test gives a result of more than 200 mg per dl, then this condition is diagnosed as diabetes. What is pre-diabetes? When HbA1c measures less than 6.4% but more than 5.7%, and or fasting blood glucose measures 100 to 125 mg per dl, and or oral glucose tolerance test is 140 to 199 mg per dl, when it is called pre-diabetes. Let's discuss HbA1c in detail. HbA1c is one of the component of adult hemoglobin, HbA. When HbA is separated by cation exchange chromatography, following fractions are separated: HbA0, HbA1a, HbA1b, HbA1c. HbA1c is a blood test that measures person's average blood glucose level for a period of 1 to 3 months. HbA1c measures percentage of person's glycated Hb, glucose that is bound to RBC in the bloodstream. Methods to detect HbA1c are immunoassay, dienzyme enzyme assay, boronate affinity HPLC, ion exchange HPLC, and capillary electrophoresis. In ion exchange chromatography, glycated Hb components are separated according to their different electrical charge. Sample and elution buffer run through an ion exchange column and fractions elute according to retention time. Quantitative measurement taken at the specific retention time for each specific fraction elute. Hb variance and HbA1c measurement. Glycated Hb measurement is standard method to investigate long-term glycemic control of the patient. The goal for most people with diabetes is HbA1c less than 7%. Hb variants like HbS, HbC and other hemoglobinopathies may give altered results of HbA1c. Immunoassay. The C and S variants are close to N-terminus of beta chain. Some immunoassays are affected by presence of these variants. The presence of HbE or HbD mutations much further away on beta chain does not affect the immunoassay. Ion exchange chromatography. The presence of any of these four variants does affect the ion exchange of Hb molecule, which may cause interference with ion exchange methods. Since boronate affinity chromatography separates the total glycated hemoglobin from non-glycated hemoglobin regardless of hemoglobin species, there is generally no interference from most Hb variants, including HbS, C, E and D. But in presence of elevated HbF, results lead to false lowering of HbA1c result. Conclusion. In presence of hemoglobinopathy or other Hb variant present, it is advisable to check HbA1c with two different methods and use the plasma glucose level as a monitoring tool for glycemic control in such patients. Complications. Complications are divided into two: chronic complications and acute complications. Chronic complications are retinopathy, food problems, myocardial infarction, stroke, nephropathy, neuropathy, gum disease, skin problems. Acute complications are hypoglycemia, hyperglycemia, hyperosmolar hyperglycemic state, and diabetic ketoacidosis. Management. Management is focused on eating healthy diet. Management with low carbohydrate diet and weight management. It is recommended to do 150 minutes per week of moderate intensity aerobic exercise. Managing blood glucose level and self-monitoring of blood glucose level. Medical management. Oral hypoglycemic drugs are used and they are metformin, semaglutide, dulaglutide, glimepiride, gliclazide, glipizide, and subcutaneous insulin recommended for daily management of patients with both type 1 and type 2 diabetes. When glycemic control is not achieved with oral hypoglycemic drugs, insulin is started in the patients with type 2 diabetes. This table shows type of insulin and its activity during the whole day. Most commonly used insulin regime is pre-mixed insulin containing 70% isophane and 30% regular insulin, which is acting up to 18 hours. These are the references for this video. Thank you.